everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know. Write us some reviews.
Oh, we got another one.
Yeah, we did.
Whoop, whoop. It was 53 last week.
Okay.
54.
54 on Apple and 159 on Spotify.
Schmoky, to fill you in, I don't know if you've heard about this. You've been on the podcast multiple times, but we're trying to get to 100 Apple podcast reviews because when we get to 100, Devin gets to experience something fun.
What's that?
We're trying not to call it a punishment. Our ideas have been she tries all the canned dog food at the clinic.
Oh, gross.
There was another one. King had the idea of smearing peanut butter on her and letting all the employee dogs lick it off of her.
Oh, that's
while
gross
she lays
too.
on the ground.
Or the milk mile.
Or the
which
milk
sounds
mile.
Awful. You chug milk and then run a mile.
Oh,
So you're
gosh.
bound to throw up. Yeah, those are just a few ideas.
She doesn't want this to happen.
Well, no.
But she's accepted her fate.
Yes. Yeah.
Well, speaking of Devin, where is she? Where's that little spit rocket?
Yeah.
Where's our little Pop-Tart?
Little blonde bombshell. She has her teethers out.
Yeah, she
She
got
got
her
her
wisdom teeth removed.
Yeah,
so
so-
she is healing. So everybody send Devin some prayers.
She looks like a chipmunk.
Yeah. But
She
she's-
sent us
she's
some
good.
selfies. It was hilarious.
Yeah, she's
so-
good.
she?
She has a good bedside nurse. His name is Walter. He's about what? 10 pounds, 11 pounds.
Probably 12 pounds.
He's a cat. So she's being well taken care of, but we miss her.
Yep. And then Dr. King just chilling
And
on the
King-a-ling-a-ding
beach.
ding
Mhm.
is, yeah.
Probably at least 5 margaritas in right now.
Uh-huh.
Or maybe a daiquiri. I don't know what her
I'm
her
so
poison.
jealous.
I
Her cup
know.
of tea is probably a beer.
probably
Whiskey.
Whiskey.
Yeah, whiskey.
Whiskey.
Shouldn't
Duh.
have beer.
She's in Aruba, right?
Yeah.
Yeah.
Aruba.
And then you leave us next week.
I wonder how many times her kids have buried her in the sand. Is that a thing, Harrison? No.
No.
It's not a thing.
Okay. Confirm she has not been buried in the sand.
Okay. How are you doing today?
Well,
Oh, who are you?
well, yeah, we have a
Hi.
guest. It's our first guest episode in the new studio.
It's our first
Exciting.
Dr. Lauren Schmok.
Late.
How are you?
Good. Thanks for having me.
Yeah, welcome
Yeah.
back. Welcome back.
Yeah.
Mhm.
Excited to be here. It looks so official.
Oh yeah.
Yeah.
Give us your
Here.
first 5 thoughts on the new studio.
Wow,
I
5
love
is a
it.
lot.
Yeah, I feel like there's a spotlight on us.
Okay,
Which
yeah.
is good. Very spacious, very
Mhm.
comfortable.
Mhm.
Yep.
I love it. Yeah.
All right. That's a good review.
We did
Can
it
you
all
put that on
ourselves.
Apple Podcasts so it counts as a review?
Jacob left us a review.
Did
And they started reading it. Nobody knew, right?
Yeah, no one knew. Yeah,
Okay, who
good
are
times.
you?
Courtney.
Hi, Courtney.
I'm here all the time.
Hi, Courtney.
Hi, Courtney.
I'm Dr. Duckwall. Okay, yeah, let's get her started. We got a couple icebreakers that look kind of extensive, to be honest with you, but it's fine. We'll break it down. Wait. Where's my asterisks?
After
Harrison,
this.
After the icebreakers?
Yes,
Okay.
I think so. Thumbs up
Thumbs up.
after the icebreakers.
He's not even listening to us. Okay, well, that's what we're going to do. Okay.
Okay. You may read the first
Yeah,
one?
you go.
All right, here we go. Hi there, coming from you. Oh my God. Okay. Restart.
Where's that?
Hi there, coming to you from Ottawa. Is that how you say it?
Sure.
Okay, Ontario. I love your podcast and have recently gotten some veterinary friends hooked.
Nice.
Thank you for that. My question is, as a registered veterinary technician, how much would you charge for pet sitting, depending on the pet? Thank you so much, and I appreciate you guys spreading the love for the veterinary community. From Hannah at Hannah.
Oh,
HLR. Hannah HLR. Thanks for spreading
The cheer.
yeah.
Way to get more friends for us.
Yeah.
That's huge.
We love
really
that.
appreciate that. Hopefully
Mhm.
they like us as well.
Mm-hmm.
Write a review and let us know.
Yes. Give us all the reviews.
This is a great
please.
question for you to lead because
Yeah.
Miss Courtney over there has her own side hustle.
Yes, I pet sit quite often. And I personally, if it's dogs, I will stay in the home. So I'll just spend the night there if the owners are comfortable. Sometimes if it's like a cat, I just stop by a few times a day, once a day, whatnot. But typically as a veterinary professional, you can upcharge just a smidge because you do have that veterinary background. You know, something happens to the pet, you're well equipped to take care of them, things like that. And I always do preface that if, God forbid, anything were to happen to the animals, I ask the client if I can bring them to my work, things like that. But typically I charge anywhere from like $50 to $55 a day. If it's really far, that might go up a little bit if I'm having to drive far distances from there to work. And then I charge $5 plus every pet after one. So if it's like 3 pets, it'd be like 60 if I charge 50 and whatnot. And I think that's pretty fair. Most people don't really say much about it. If I'm just like stopping in on cats, it's like 20 to 30 bucks a day.
Yeah.
Like I said, again, depending on how far I drive, but
I think it's a huge benefit because you can give meds.
Yeah.
And you
Yeah.
can do more.
And I think people just truly feel better when because then the animal's comfortable. They're not getting stressed at a boarding facility. You're not worried about, I'm not saying boarding facilities are bad, but they have a lot of animals to worry about.
Yep.
Yeah.
So when I
will say, as a paying customer of Courtney, I feel much, much better leaving my whole farm with her.
Literally.
Yeah. Literally. I mean, I think also it's a little different. We're friends too. So I kind of know she'll reach out just even with pictures. But like, every time I have to have her help me out, I think of how grateful I am I don't have to worry about the boarding facilities because of just the stress. I feel like, I mean, I know a lot of dogs do fine, especially if there's play groups and stuff. So I don't want to make it sound like it's not a good option. It's just, I think it gets very comfortable and you can have them come into your home and just not worry about it. So
yeah, I like it. I think one of my favorite things about pet sitting is when it's like my actual patient that I see at the clinic and then I get to see them in their element and they're like themselves and not scared and stressed. That's like my favorite thing.
Yeah.
And it's just fun.
Yeah,
I get to cuddle with all different kinds of dogs.
Yeah. And they come into the clinic and they recognize you and makes it better for them in that regard. So
yeah. So that's my answer for that.
I think it's key that it's okay to charge more than your average if you're a veterinary technician.
Yeah.
I think that's fair.
Yeah. I agree.
Thanks, Hannah. Hope that helps.
Yeah. Hope so. If you have follow-up questions, let me know.
Yeah. Yeah. Okay. Number 2. I was wondering if y'all could elaborate a little more about your thoughts on chemotherapy, the requirements, extra training for staff, how difficult it is, etc. I've heard doctors say that they don't offer it because it's a pain in the butt to have to deal with it, and that some treatments don't work that well, things of that sort. Could you talk about the pros and cons of offering chemo for your patients and the different kinds of protocols? At freddystory.vet.
You're a reoccurring listener.
Yes,
thank you so much for your support and good questions.
Yeah.
You guys just went through this.
I know. We kind of touched on it at the last a couple podcasts ago. So I guess thoughts on chemotherapy. If you can do it in your hospital, it is so accommodating for the owners. They are much more comfortable because the pet is going to where they usually will go. It's not a new facility. I mean, to be honest with you, the price is usually better when we can offer it because of we're XYZ, so many things, right? We're not the specialists. But that being said, we are more limited on what we can administer because we are not the specialists, or maybe we're doing like the generic protocol, not like a new improved protocol because we just don't know about it. I don't know. What do you think, Schmok?
Yeah, I think something that a lot of people don't realize is that chemotherapy in dogs, they can handle it a lot better than humans can. I think we talked about this briefly in the past too, but they just don't have as aggressive side effects as people do. And you think of chemo, you're like, oh my gosh, it sounds terrifying. I don't want my dog to go through that. But I know one thing that's been talked about is you use like the lowest doses possible in veterinary patients because your goal is just to improve their quality of life and extend their quality of life. You may not always get like 100% remission. Sometimes you don't really know, but they handle it really well. And if they do have side effects, you know, we're always accommodating, getting them in quickly, giving them supportive care. And a lot of patients, veterinary patients, do awesome. So if you already have that relationship with a client, just keep it in-house. It's awesome for them because they trust you already.
Yeah, for sure. I mean, I think we did have not a seminar, but like a lunch and learn for the technicians regarding the EquiShield product that we use. And it's, I don't know if you want to speak to it because you use it more than I do, but basically the equipment you need to safely administer. So, I don't know. Like,
yeah, I don't know how like new EquiShield. I mean, it's new to us. So it's the EquiShield brand, and it's pretty much a what's the word I'm looking for? It's like an airlock system for chemotherapy drugs. So then the drugs are not getting aerosolized into the air where we can breathe it in. It's much more safe for whoever's handling the drug because it keeps it in that system and doesn't allow the drug to get out, like I said. So I don't know how common it is, but I think it's really cool. If you are thinking about doing chemo, that kind of stuff, I would definitely look into that because it's much safer.
Yep.
And the training, as long as you have a rep come out, they're very, very helpful. And so the training is pretty easy with it. It's not hard to learn. It's a little scary at first because it's a new thing, but
yeah,
I think it's very helpful. Yeah. I liked it. I mean, it's different. It's more steps, I guess, but in the long run, it's safer for you. So I liked it.
Because most general practices don't have like hooded ventilation and stuff.
Yes.
So that's kind of the way, like you said, to protect yourselves from doing it. And then of course, like, I don't know, as far as difficulty, I think it's, if you're comfortable giving an IV drug and placing a clean catheter, it's really not difficult, but I think you have to be comfortable with being uncomfortable in case something went wrong.
Yeah. Yes.
Because many drugs, if they go outside the vein, can be really dangerous, like really bad. So I know it still makes me a little uncomfortable, even though we've done a full protocol.
I get uncomfortable too, still.
Yeah. And I mean, you have to definitely trust your nurses who are handling and trust that they'll do the catheter, or even if they're uncomfortable with their catheter, they call you to talk about it. So I think you have to prepare everyone if you're willing, and make sure everyone's willing to do it.
Yeah. And whoever isn't, you just say you're not.
Yeah. Yeah, pretty much. And we have biosecurity, make sure you gown up. Make sure patients coming in and out of the hospital aren't near those patients. So I think we're kind of going through the pros and cons without specifically listing them, but you can kind of sort it out. And I think there's more benefit than there is negative because of what we're able to then just do for the family.
Yep.
I just don't know if we can do we obviously can't do every protocol.
Yeah.
So that's the only other thing is like, I don't know how many more we can introduce. Like we do. Yeah,
we only offer CHOP.
Yeah.
Yeah.
And then variations of CHOP.
Yeah. But I don't know what goes into necessarily everything else. Or the other ones that like VC and MedVet do. I don't know.
Yeah.
Because clients ask me and I'm like, I don't know.
Then there's also the monitoring. We just had a patient go for basically anal gland adenocarcinoma.
Yes.
And we couldn't even like see the extent of that cancer because we don't have a CT.
Yep.
So obviously then that's going to go for surgery because we can't do that surgery. So some are just better off being referred.
Yeah. Yeah.
So lymphoma is kind of straightforward to diagnose.
Yeah.
And then treat. So
yeah.
Okay. Hopefully that helps. But if you want us to answer a different icebreaker question, DM the All-Star Veterinary Clinic social media accounts or email at Harrison at kingmediamarketing.com.
If you understood that, let us know.
If not, go back and slow down.
Okay, next on the agenda, Pits and Peaks. So Schmokey, this is also relatively new. Have you heard of Pits and Peaks before?
In general, not on like the podcast.
Okay, great.
Yeah.
Okay, awesome.
Yes.
Do you want to start us off?
Sure.
Okay.
Woo.
Does it matter which one I start with?
It does not.
Okay. A pit. I had to think about this for a second. I was like, my week's been pretty good. But one negative is that Purdue lost. We were just talking about it. Very sad. I was at Purdue undergrad and vet school there. I don't really watch sports that much, but when they go that far, it was very cool. My parents also went to Purdue. So we're a big Purdue family, and that was sad.
Yeah.
My husband also is a diehard. So we did stay up for the game. Yeah, it was a late night and then had to go to work the next day.
Oh, yeah.
So
that's also a pit in itself.
Yes, exactly.
Going to bed past your bedtime is the worst.
Yeah.
Yes. And then one peak, I got to see Fig. I don't know if you met him.
Oh my God. He came in yesterday.
Yes.
Oh, I thought I saw him.
He got his sutures out. He was foreign body that I did like a week or two ago.
He was the one King talked about on the podcast, the two vets that had to overcome a lot and do the surgery.
Did she talk about it?
Uh-huh.
Is that the one I wasn't here?
Oh, maybe you weren't here that episode.
Okay, you're going to have to recap now.
Yes. So he's 6 month old. Wait, 6 or 9 month.
I think he's 9 months old.
Yes.
Yeah.
Young dog that ate some things he shouldn't have, which is very common. And the owner brought him in like 3 or 4 days after he started showing signs. At 5 p.m. And I think it was like 4 p.m. It was Ham's case, and she did x-rays. It looked very bad. So I was on surgery that day, and I said, I'll do the foreign body surgery. And I've done them, but this one was extra special because it was my first resection and anastomosis surgery. And after hours, so all the support that we have with each other was gone. It was gone. Yeah. So Ham ended up staying, thank goodness, just to have another set of hands and eyes to help with it. That was the most intense foreign body I've had, just because we did an RNA, removed 5 inches of intestines because the pieces of plastic were very sharp and they were poking through, the one was starting to poke through, hadn't fully like perforated yet, thank goodness. So I'm glad we did it when we did. And then I did a gastrotomy and 2 more enterotomies.
Oh my gosh. This is why you guys were there till midnight.
Yeah, we left at like 11. Yeah. Oh my God. So King, she stepped in initially, and then she had a hair appointment, and then she came back. So she was in and out helping too. So
that's good.
We were FaceTiming her while she was getting her hair done. And we're like, "Does this look okay? Should we do this?" And my technician's like holding the phone over the intestine.
That's amazing.
And she had foils in her hair. But she popped back in. We looked at everything. I was super happy. But I did lose sleep over that because RNAs are no joke. And he stayed the night that night. And then 2 days later, normally, you keep him low key to heal, exercise restriction, and all that. Minimum 10 days. Well, the owner needed to take him to Florida.
Oh, I didn't know that.
2 days later. Yeah. So his family, his wife and kids were in Florida on spring break, and it was the Friday before Easter, and he wanted to be down there with them in Florida. So he said, I'm taking Fig to Florida in the car. Luckily, he left the other dogs at home just so Fig could be calmer, which was a good decision. And so I'm texting him like on Saturday, like multiple times as he's going down to Florida. And he's like, he went potty, he's eating, he's doing well. And like the critical time is that 72 hours. Once he made it past that, I felt much better that he was going to make it. And he did really well. I think also his age is on our side because when they're young, they just heal so much quicker. But I got to see him yesterday. He came in for suture removal and he looked good.
So excited. He's so cute.
Yeah,
he's so cute. Yeah, they killed
terrifying. Anyway.
Wow.
That's fine.
RNAs are like seriously the only reason why I don't want to do foreign bodies, because I don't want to have to go in there and do an RNA. It terrifies me. Yeah. So good job. You did it. Yeah. You're an expert.
Oh no. That's my first one.
Never again.
Wow. What kind of dog is he?
He's like a pity. He's so cute.
Oh,
he's so cute.
I like that
I'm
name,
so
Fig. Yeah. That's cute.
He's just a pity
just,
thing.
Like, laid back and like a little timid, not like afraid of us, but I think the whole experience.
Yeah. Well, when he stayed, he was giving us all kisses.
Yeah.
And he was just so sweet. Yeah.
Yeah.
He was awesome.
That's a pretty good peak.
Yeah.
Yeah.
You did it.
Thanks.
Okay, I'll go.
Okay.
My pit. It was just a busy week. I don't know.
Yeah.
I was solo parenting. My husband had to go travel, and that always just is difficult.
Yeah.
To say the least. So, but it just makes me stronger.
Yeah. What a
Gives
good
you more
hour.
time to have one-on-one bonding.
Oh yeah. Yeah. So that was probably the pit, just a challenge. Peak, honestly, the eclipse, and I wanted to talk about it because it was so.
Oh, I forgot that already happened.
I know.
That was this week.
A long time ago.
That was this week.
That was this week.
Okay.
It was really cool. I'll be honest. I was one of those people where I was like, this is stupid. Why are people shutting down? Why is there traffic? Like, why is our daycare closed? But it was really cool.
Yeah.
We were in the path of totality. So like going out and it just getting dark was so eerie.
Yeah, it was bizarre.
That was really bizarre.
Yeah.
And you're like trying to capture it, but enjoy it. And you can't really capture it because it's just like this like ambiance feeling of
Yeah.
nighttime. That was weird.
Yeah.
Yeah.
It was much cooler than I thought it was going to be,
Yeah.
for sure. Because I was kind of like, okay, really? Is that big of a deal?
Yeah. You got some really cool
But,
pictures
yeah.
too. But like we tried to film it, like doing videos, and Devin, she was filming when it first happened, and we all freaked out because we saw a star like in the middle of the day, which was Venus, I guess. But yeah, that was really cool.
It really messed with your head because you're like, oh my God, it's 3:00, but it's pitch black out. Like the lights on the building came on.
All the
That's how dark it got.
I didn't notice that.
They automatically flipped on the clinic.
funny.
Yeah.
I don't think the animals really acted that weird though. I was anticipating like when they do full moons and stuff, where they're just like all the cuckoos come out. But I feel like I don't know. I didn't notice anything with the animals really.
Yeah.
My uncle's dog Marty.
Yeah.
When it started getting, so he was outside, and when it was all happening, and it started to kind of like get a little bit dark, and he was just like staring at the sky. He was like freaking out. And then when it got like super black, he just started going crazy and barking and running around the yard. Yeah, he was freaked out. They have videos of it.
He's like, I'm a werewolf.
Yeah. So he tried to eat the darkness, but yeah, he freaked out for it. And then my parents' dog, Mabel, who has like severe storm anxiety, like if the wind blows the wrong way, she pees her pants. Like she like, it doesn't have to rain. It just has to get dark.
Yeah.
And so the second it got dark, my parents said she flipped out and ran upstairs. Like she was petrified.
Huh.
So
weird. But she's very sensitive to weather. If it's not sunny and like 75, she's not well.
Yeah. Not a great place to live in.
Yeah, I know.
Sounds like a Florida dog.
Yeah. But it was very cool. That was a good peek.
Yeah.
Yeah.
That was a very good peek. Okay. I'm going to start with my pit because it's good to end on a high note. My pit this week was my husband's best friend, who is pretty much my best friend, got in a car accident. He's doing well. I'll just preface by saying that. Yeah.
Mark.
So he's doing good. But we all are on this app called Life 360. I don't know if you know what it is. It's a tracking app, and you can just add multiple, it's like a family group, and you can add whoever you want to it.
Oh.
And I woke up, it was on my day off on Tuesday. And so I woke up at like 8:39 to a text that says, Mark may have been in an accident. His phone stopped abruptly. Please contact him.
Oh.
And Jacob's gotten that alert for me before because I got in an accident, and it is horrible reading that. And so I called Mark. He didn't answer. Jacob called him like 3 or 4 times. We texted him like nothing. And we're like, oh my God. And his car, like we could see where his phone was, and he was just sitting in somewhere like down the street from his house. And we're like, oh my God. So then a few hours later, we finally got a hold of his sister, and she told us he was in an accident. He was rushed to the hospital, and we're like, oh my God, like this is not good. And they didn't take his phone, and like we're panicking. We're like, okay, we got to buy a ticket to Florida because he lives in Florida.
Yeah.
And so we're like, we got to buy a plane ticket. Like we don't know what's going on. And then he ended up busting both of his knees. He had sutures in one of them because he hit him on the dashboard.
Yeah.
And then he hit his head. But just concussion, CT, and everything was normal.
That's
but
good.
That was really scary.
Yeah.
And especially when you can't get to them, it's horrible.
Yeah.
But he went home the same day. So he's doing well, just really, really sore.
Yeah.
He hurts everywhere. But yeah, so that was scary. That was fun to go through.
Yeah.
And then my peak, I bought a friend.
What?
Is it alive? What is it?
Yeah, it's just been taking a nap in my pocket. So my mom got this for me. It was a late birthday present, and I pet sat for them last weekend, and I went over there, and I've been talking about them because I just think they're so cute. And I was like, I want one, but I want to be surprised.
Okay.
Because it's something that you should get somebody when they're like least expecting.
The anticipation. What is it?
What is that?
What the heck is that?
It's called a positive potato.
Oh, that's cute. Let me see.
And he says, I may be a tiny potato, but I believe in you. Go do your thing. And so I carry him around with me. And when I'm having a hard time, I look at my positive.
Oh my God.
We can pass him around.
I'm going to get this for my team.
But they have every kind of vegetable under the sun. They have a positive poo, too.
Does it all say the same thing?
No.
Oh,
they all say different things.
That's so cute. I need to get these for people.
Yeah.
Oh, a positive.
It's so cute.
It's so cute.
Does
he have a name?
They're on Amazon.
Amazon. Okay.
No, him just a positive potato.
He said,
he can
I really
be Paul
want
the
this.
positive potato.
I want this crocheted potato.
Yeah, isn't he cute?
He's actually really cute.
And he just see how happy he just made both of you.
Yeah. True.
Well, watch out. Your dog's going to eat it. And
Yeah.
swallow
Oh,
it
he already
whole.
tried.
Yeah.
Mm-hmm, yeah.
Yep.
He stays with me. He's very protective. He's my buddy.
Oh my God. Okay, now I really want to look up. Please leave him here. I feel like he should be talking.
He'll come with me every podcast now. He literally goes with me everywhere. If I'm going out, he's in my purse. When I go to work, he's in my bag.
Yeah, watch out. I feel like a dog will just walk in and
I know.
swallow it whole. Then Schmok's gonna have another RNA.
Yeah, no. Keep that away.
I protect him with my life.
Have you ever seen the videos Marcel the Shell?
Yes, with the
That's
shoes
what
on.
I feel like. He's just gonna start talking in a high pitched voice.
Yeah.
Hello, my name is Marcel the Shell.
I used to be obsessed with that. I used to talk like her all the time. I don't think I remember how
I feel
to,
like it's like a 90s. We were born in the 90s, right? Yeah.
High school, yeah, for me. Or maybe middle school.
I don't remember.
Do you know there's a movie now?
Yeah.
Like it's been produced and made?
On Netflix, I think.
Yeah.
Of Marcel the Shell?
Yeah, it's new.
What are you doing tonight?
That's why you were bringing it up.
No.
Okay.
Yeah, there's a movie. They made a whole movie about her.
No.
Marcel the Shell with shoes on.
With shoes on. I forgot she Okay, I'm totally watching that. Probably with a bottle of wine.
Yeah. Yeah.
Okay. Wow.
Okay.
That was a great way to end the
Thank you.
Bits and pieces.
I love it so much. Like, I walked into my parents' house to take care of their dog, and this was just sitting on the counter. I screamed. Nobody was home with the dog. And I was like, Mabel, look. It just makes me so happy. I just love it.
The little things.
It's gonna be like one of those remember those things, what were they called? Not Chia Pets, but they're like electronic squares and they were your pets that you had to feed. Tamagotchis.
Yeah. Tamagotchis.
It's the new age Tamagotchis.
But like, I'm not kidding. They have every vegetable you can think of, and they're just crocheted. Like, the person who invented this is a genius.
Mm-hmm.
I feel like I would want a beet or something very weird.
They have a green onion.
Okay, that'd be cute.
It's cute. Okay, anyway.
Okay. Moving on. Case collections.
Oh, shoot. I didn't think about this part.
Oh, Courtney's in trouble.
Go ahead.
Schmokey, you go first. You're the guest. Guest of honor.
Okay.
You go first on everything.
Okay, my case, this was actually yesterday. Mr. Rudy came in. We diagnosed him with a mast cell tumor last week, and he's a little pug. He's very cute.
Aww.
He had a mast cell tumor right on the side of his paw, kind of like his wrist area. And it's a bad spot because when we try to treat mast cell tumors, ideally surgical removal is like the best case scenario, but we need margins. So the mass, and then ideally 2 centimeters around, and a tissue plane deep. And so when you're on that area, it's just not possible to get those wide margins. And so there's a newer treatment. I think it came available in 2021 called Stelfonta. So we treated him with Stelfonta yesterday, and it's been about 24 hours, and it's going well. I've been checking in on him, and the owner sent a picture today, but it is crazy what happens. I don't know if you've had one yet.
I've just seen pictures. Yeah.
And we've done a few at All Star, but this is like the first one that I've had personally. So when I was talking to the owner about whether or not we should do it, we just have to make sure, they're a good candidate. And when we can't do surgery, really, it is the best alternative. And so he came in yesterday. We sedated him. If they're wiggly patients, it's just best to do that because you want to make sure when you inject right into the mast cell tumor, it goes in and doesn't come out at all. Myself and my technician and then my assistant, we were all together. We put gowns on, gloves, safety goggles in case, it were to like squirt up in the air. We don't want that. So it is an anti-tumor drug. It's really interesting. I guess it came from a plant from Australia.
Oh,
I did not know that.
I did not know that. Fancy.
And just became FDA approved. The actual name is like Tiglanol Tiglate or something. It's kind of a funny name. And
sounds like something the potato would say.
Okay, sorry. And so it is approved for dogs that have mast cell tumors on top of the skin. So cutaneous mast cell tumors that can be anywhere on the body. But in my case, this was a subcutaneous tumor. So under the skin, kind of in that fat layer. The tumor has to be elbow down or hawk down on the back leg. And then you inject right into it, calculate the dose based on how big the tumor is. And then it's crazy. It actually causes like lysis of the tumor cells. They rupture and then it cuts off blood supply to the tumor. And it creates this crazy, crazy wound at about day 3 to 7. So we're not there yet. It's going to happen. I've been prepping the owner and having her look at pictures on their website, which the Stelfont website is amazing. If you guys are interested in looking it up, it's great. It'll kind of, the mass will slough off and then it'll be a really big wound. And not only where the mass is, but the wound can like extend all the way up the leg in some cases.
It's wild. Can it go down to the bone too?
You can like see tendons sometimes. Yeah. But it's crazy. It's a very hands-off approach aside from pain meds and then like the medications that they need to protect them from like the histamine release or degranulation. Aside from those medications, really you don't do much. Like hardly any of the cases need antibiotics and you leave them open. The dog can lick it.
It's crazy. It's so opposite. It goes against everything.
Yeah. And healing is usually like week 4 to 6. So it takes a long time, but eventually they do heal and they end up with like a little scar and the hair grows back in. And so 75% of cases respond to just one injection. 87% success rate with like 1 or 2 injections. So there's a chance we would have to go back and re-inject in a month if it wasn't fully gone, but majority of cases do really well. So he's hanging in there. He's being a little stinker with the medications right now, according to mom. So we're trying to get creative on getting those in. And pugs, if they don't want to do something,
they ain't going to do that.
Yeah, they don't. Yeah. So I had her pick up some canned dog food. We're going to make some meatballs and stick it in there and try.
Yeah. Is it just Benadryl you have them on, or do you do Pred too?
Pred, Benadryl, and Pepcid, and then gabapentin for pain. I think she may be picking up buprenorphine for pain as well. It is in a really sensitive spot because it's like his lower leg, and so walking can be tough. Yeah. And she sent me a photo. It's pretty bruised and red and swollen, which we expected. Yeah. I'm like, it looks like it's doing its job. I know it looks crazy, but
get ready.
Get ready. Yeah. So
that's wild.
Yeah.
It's a crazy drug.
Owners definitely need to look at those pictures because they would freak out if they don't.
Yeah.
I would freak out.
Yeah. Skin just sloughing off.
Yeah, I would freak out.
Yeah. Beat. Yeah. But it's a great option.
Yeah.
If you can do it. I feel like I've had, every time I try to go to see if I could do it, it just doesn't fit in those parameters. And so, I don't know.
Yeah, we have yet to
when
do
you
it.
can use it, I guess.
We'll see. I'll keep you updated.
Okay. Yeah, you have to let us know. Really get pictures of the nitty-gritty.
You should do progress pictures like every week. That'd be cool.
Ones.
I want her to send them every day.
Yeah.
So hopefully we'll have just like
that'd be cool and put them all together. Yeah. That'd be really cool. Especially we could keep it at the clinic and say this is an actual patient. We did and that
content.
But like then we can show owners like this is an actual patient that we saw instead of just this is a random animal from a random case study. I don't know.
Yeah.
I think I remember seeing Dr. McDivitt's case and like the bad days were like,
I did not. I have yet to see a picture of it.
Yeah, it's quite interesting.
It's quite interesting.
Yeah.
Okay, good case. I'll go next. I'm going to talk about a kiddo named Roscoe. Yeah. So he is a Bernedoodle that I saw for another opinion, essentially. Another opinion. Basically, his history was he had an original foreign body surgery at another clinic. And then I don't know the timeline if it was like at the time of suture removal or during his recovery period for that first surgery. He ended up getting an abdominal hernia from his original incision. And while they were in there, they needed to do some correction to the stomach incision. That is kind of the gist I got from the owners. And during the second surgery recovery, Roscoe had some complications with inflammation, concern for infection, where he was seen at an ER facility. And so he actually had to stay there for 24 hours because the ER facility was concerned they'd have to go in again due to basically peritonitis infection of the cavity, abdominal cavity, or was there something leaking? They weren't quite sure. And so thankfully that did not have to happen. And they were suspecting he was having a very significant reaction at his incision line. And so he went home with continued care with antibiotics, pain meds, things like that. And then I saw him during that time frame of healing just to get established and then to kind of set up a game plan of finishing the recovery and then just moving forward with his life from there. Well, everything was looking really good at the time of his visit. He still had another week left in recovery, but we adjusted some meds as far as sedation meds, pain meds, but that was about it. He was pretty comfortable. He did have staples along the incision, but they looked okay. There was one spot I was like, we'll keep an eye on it. But yeah, so then he came back a week later for the removal of the sutures. And unfortunately, I palpated another hernia along the incision line, and it was fairly decent size. And unfortunately, the intestines fat, I could feel it start to want to come out. And of course, you can't have a dog just live the rest of his life that way because intestines could get entrapped, cause issues, not good. So I had to tell the owners, and they're amazing people, but unfortunately, he needed a third surgery. So we did it on Monday. I did it on Monday, and it was much more difficult than I anticipated. And I knew there was going to be scar tissue because he had 2 others within the last month, essentially. But man, going in there, I honestly couldn't tell where the tissue planes started and where they stopped. And it was just, some tissue was angry, some tissue was just straight up abnormal. So just with the help of another colleague, did the best I could of removing all the abnormal tissue. I actually was concerned that some of the suture material was infected because as I cut it out, there was like pus-like cystic material that came out with it. So I also cultured tissue. I cultured that pus material to see what infection is present, and then obviously so we can treat it appropriately. So I essentially had to go in and just take a whole bunch of stuff out and freshen up all the edges so I can promote good healing, and closed the bejesus out of it. Like, I did so many sutures so close together because if one failed, I didn't want multiple to fail. And it was a long surgery, and it was difficult, but he did okay under everything. And he's in healing. So I was really pleased with his comfort, because that type of, you're cutting out so much that I knew he was going to be painful, but he was pretty controlled on pain when he went home, and he's just a rock star dog. He's so chill, but they said even at home he was doing pretty well. So fingers crossed it all stays and there's not something weird going on, because, as you remove stuff and pull it tighter and tighter, you create this greater risk of creating hernias in the muscle bellies. And so that's Roscoe. Yeah. We'll see. And I don't have the cultures back, but hopefully it's nothing too crazy.
Yeah.
Yep.
That's so hard when I had one similar.
Yeah.
And it's just, when you go back in and you're like, what is this?
Yeah.
Like, it just, everything
I think
looks
that's
crazy.
what she said the whole surgery.
Yeah.
She was just like, what is happening? What am I looking at? What is this part? What is that? Yeah. It was
not
intense.
normal. So
you just go up as far as you can and as over as far as you can to find normal as best you can, and then work your way in.
It was intense. Yeah.
But by the end, I felt really good about it. It was just.
Yeah. The beginning is like,
yeah, exactly.
Yeah.
Okay, well, my case is going to kind of be a PSA. I'm going to talk about my personal dog, Miles, because he just has issues all the time. I never run out of fun things to talk about with this dog.
I need to look at his paw pad. Don't let me forget tomorrow.
That's what we're talking about today.
Okay.
So this past weekend, I took my dog over to play with my best friend's dog. And they have a rooftop on their apartment building. And so we kind of just took the dogs up there because they live, like I said, they live in an apartment. So there's no like grass area for them to play in or anything like that. And so they were just running around on the balcony for a little bit while we were all just hanging out. They weren't doing anything like crazy. Like they could have played harder and they didn't. And the pavement was pretty smooth. So I wasn't thinking anything of it. And then later that night, he would not put any weight on his back left foot. And I looked at Jacob. I'm like, I swear to God, if this dog tore his cruciate, I'm going to kill him. So that's the first thing I thought of. I was like, great, that's awesome. It's fine. And then come to find out, Jacob looked at his paw pad and he was like, there's a big chunk taken out of it. And I was like, oh, good. And then his right back paw had another little cut. It wasn't as bad, but the left paw pad it had a chunk like just hanging there. And he's done this before. The first time we had to cut the little sliver off because it was just bothering him and bandaging. I just didn't want to do it. Yeah. So we just cut it off. But this time, I was kind of just keeping an eye on it because I left him at home Monday, whatever. And so I was going to have her look at it. And then last night I take a look at it again and the piece of skin's gone. He chewed it off. Like he hasn't been bothered by it at all. And I've been keeping him away from it so he doesn't make it worse. But he did it on his own. So we're in the healing process. Go Miles. But yeah, he just chewed the little piece of skin or the paw pad off. Yep. He just chewed off his little paw pad piece and it's just like an open wound now, which is irritating because it's a stupid spot to have a wound. But I feel like paw pads heal pretty fast.
Yes.
Yeah. Considering they walk on them all the time, they heal very quickly.
Mm-hmm. You can't suture them. No. You can bandage, but you don't always even need to do that. Yeah. So.
But he's doing fine. He's just annoying. He's very irritating.
It's like injury.
It's like 1 week or every week is something different.
Yep.
Yeah. I'm texting her. I'm like, Miles did this, and this is happening to Miles. Because then I feel like your own dogs, you just lose all sense of like common sense, and then you just freak out because it's your own dog. That's my kid. Like when he gets hurt, I'm like, oh my god.
Frank's been sleeping more, and I'm like, are you okay?
Yeah, exactly.
Do I need to X-ray your body?
Yeah, exactly.
But we need to do blood work on Levy for no reason. She's not even due for her annual. I just bring her by. It's like I just have a feeling she's fine.
Yeah.
I get it.
We see the worst of the worst. So when little things happen, we're like,
yeah. Oh yeah.
But no, he's okay.
That's good.
Yeah. But I don't know if he has sensitive paw pads or he just happens to have that kind of luck. This is the second time he sliced open a paw pad.
I feel like with what you're describing where they were playing, it's so common, especially getting into the warmer weather because
he did it last summer.
Hot concrete. Yeah. Oh yeah. We see a lot of those, I feel like, in the summer.
Oh, that's my PSA. Don't let your dogs play on a balcony. On cement. Have common sense. And I didn't have.
It's okay. It's fine.
He's okay.
Good cases, gang. Yeah. Now we're finally to the listener question.
Mm-hmm.
This is going to be interesting.
We're not actually doing a listener question.
Just kidding. Skipping it. Well, it's one, as you can tell, we weren't really thrilled about doing because we had to do homework. And we just don't want to do homework. But we did it because Harrison told us we had to.
We did.
The listener, well, it's not really a listener question. It's just discuss everything and anything regarding the avian flu that's going around in rural areas right now with cows and other farm animals.
Well,
yeah.
Us three work a small animal.
Yes, sir.
So we're not around cows.
It's been around a long time. Let's just start by saying the avian flu has been around forever.
Yeah.
And it's been a problem. I think I saw 2020 is when it really was like, freak out. Because a whole bunch of commercial poultry farms were getting hit. And so that's where it started. But now, was it this year? It started affecting cows?
Yeah. Like recent.
Yeah.
Very recent.
It was like March 25th, end of last month. I think it was like the first reported case. And it's super, super rare to affect cattle, which is what I learned. But they were noticing like decreased lactation and low appetite. And so they reported the first case end of last month. And then because it's so rare in cows, I think everyone jumped on it, like investigating. And then I also learned that there was a human case reported April 1st.
Oh,
and the guy had been working at the dairy farm. And so then that was like, oh crap, this
when it gets to humans, that's scary.
Yeah. I think his was mild, right? It was like conjunctivitis and that was it.
They just quarantined him, gave him antivirals. And I think his household went on prophylactic antivirals and he's all good. But yeah, I think that raised some red flags. So it's still being investigated. I don't think they know exactly, but wild birds is what I heard they suspect it's from. But the one interesting thing I read too is Texas and Kansas were the first states to report or have reported cases, but then now there's 6 states. I know you were talking about
7 now.
7.
Yeah.
The one, sorry to interrupt you.
You're good.
The confirmed cases right now say there's 4 in New Mexico, Michigan, Texas, Ohio, Kansas, Idaho.
Yeah.
North Carolina became the 7th state to detect. That was yesterday.
Yeah.
Okay.
Yes.
So it's there.
Yeah.
Here it comes.
Well, I guess the biggest thing, of course, being public health, is people want to know, do we need to freak out? And from the articles I read, is it's extremely rare to go from human to human. And even getting it from the cows, it's those farm workers that are like in the trenches and contact with it every day.
Mm-hmm.
So I think even getting the human getting it was a shock. So
Yes.
it's basically like, don't freak out yet. They have vaccines that could be like utilized if it
Mhm.
became a huge issue from humans to humans and stuff like that. But I think I read because it's primarily in wild birds and you can't really in
Wild
the
birds don't
trading
like
and
us.
everything. Well, yeah, you can't control it. So
Yeah.
you don't want to create an environment for the virus to mutate to
Mm.
survive, but then it mutates to then infect humans better. So then that's why I heard vaccines wouldn't be considered unless you're like a farm worker in basically that environment
I see.
with higher risk.
Yeah.
So because they can't figure out, like, the mutation of the gene hasn't happened with a virus to be concerning for human to human. So.
Yes.
Yeah, I think the public health risk they said is low just because they haven't seen like a mutation. It's the same strain that's like been around, but I think they're still trying to work out transmission too because yes, that worker worked on the dairy farm, but it still could have been spread to him through birds that were also on the farm.
Oh, gotcha.
So I don't even know if they know that part yet. But the one interesting thing is that the Michigan case, that farm had cows from Texas travel to that Michigan farm. And so they can't rule out cow to cow transmission, which would be a new thing. So they're like looking into that.
Yeah.
But as far as like your milk product and stuff in the stores, they're saying, don't worry about that. It's safe because of the pasteurization, which kills viruses and bacteria. So you don't have to worry about consumption. It would just be more of like your exposure if you worked directly in those environments.
Yep. Yeah.
No need to panic quite yet.
So
There's
drink
a lot
some
of unknowns.
pasteurized milk.
Yes. Moral of the story.
Don't do
Yeah,
raw
right.
anything right now because,
Lots of unknowns.
hopefully that was enough information.
That's all we got.
Because that's kind of all we have at the moment.
Yeah.
Stay tuned.
Stay tuned.
Yeah.
We have our articles,
as
but-
we hear them in the studio.
Yeah. It's H5N1.
Mm-hmm.
If anyone wants to know, it started in China.
Don't
in
go play with
1976.
cows you don't know. Don't go milk a cow just for fun. What the farmer's doing.
Oh, also, if you have pet birds, they're less at risk because it's smaller flocks. I freaked out for a moment about avian influenza because I have 3 ducks at home, but apparently I don't really need to
I was
worry.
like, you don't have a pet parrot.
No, I got ducks.
Forgot about the ducks.
Yeah.
They're birds.
Mhm. Anyway, I don't have a cow though, so I think I'm okay.
Yeah, I think so too. Yeah.
Okay, well that's all we got.
You would do
Write in if you got more info if you want us to
let
talk
us
about it.
know.
But we like dogs and cats, so
Yep, we'll stick with those. Yeah, that's good.
okay.
You
go
want me to do the
for it.
outro? Oh,
Yeah.
dear. Alrighty, here we go. Thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and please, please, please leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.
See ya.
And for my positive potato, goodbye.
Bye.